Dr. Doppalapudi, thank you for your time today. You are a specialist in infectious disease at Northside Hospital, and currently you're treating COVID patients. How has that experience been?
Thank you, Navan, for doing this first. Experience, when talking about experience, we went through all range of emotions, starting from, when the pandemic started, there was a lot of unknown. So starting from fear, and then month by month, knowing more and more information, all the way up till now, which is hope is the predominant emotion right now going on with the vaccines being available. But it's a life-changing experience, for everyone going through it, not just for physicians, of course, but going, seeing each person going through their own struggles, and then seeing them hanging on to hope day after day, week after week, going on to weeks for so many people. Just hanging on to the hope to just stay alive and just seeing them, it has been so humbling.
Okay, yeah. I can see how it can be stressful for not just you, but for all of us. And also that sense of hope. I mean, it's something we all need, especially now. Now I just want to ask, have you taken both doses of the vaccine, and have you had any side effects or reactions? And then also, of people that you know who have taken the vaccine, have they had any side effects or reactions?
Yes, I did take both the shots. I got the Pfizer vaccine, which is you have to get the first shot, and then 3 weeks later you get the second shot. So I completed both the shots. Most of my colleagues that I have already got both the shots, and more healthcare workers are getting more and more are getting right now. So with my experience with both the first and the second shots, what I experienced was just arm pain. Started like around 8 to 12 hours after the shot, and then it went away by 24 hours. I didn't have any further symptoms with both of them. But based on the reports directly from my colleagues, as well as published reports, are that, first shot, again, arm pain, local reactions are being reported commonly. With the second shot also, local reactions are being reported commonly, but systemic symptoms, by that I mean a fever, fatigue, headache, chills, they are also increasingly reported. But most of the people who have reported these symptoms are mild to moderate. It is very rare to have severe symptoms like these. Yes.
Okay. Yeah. I think that's something people need to know, whether there's side effects or not. And then building upon that question, what were to happen if someone were to only take the first dose and just not take the second dose?
If there are some vaccines like, which is not in circulation yet, which is only one dose, which has not yet come in the market, which is Johnson & Johnson. But all other vaccines, the ones in circulation are the Pfizer and Moderna, both are 2 shots. So they have found that if you get just 1 shot, there is still protection. So it's not like, something is better than nothing, of course.
Yeah,
so correct, you will still get some protection, and it is estimated to be around or more than 50%, in fact, if you get 1 shot. But obviously the booster shot is what gets you to the highest efficacy, which is around 95%. Okay, and you have to understand the efficacy, it's not immediate. It takes time for our body to build the antibodies. So say it takes starting 1 to 2 weeks is when you will actually start to, feel that protection.
Okay, that makes sense. And then adding on to the vaccine, is the vaccine considered a solution? Like, is it a treatment or is it more of a prevention method?
Vaccine is a prevention method, Navan. Vaccine preventable diseases is what we call. So it's for prevention. It's to even before you get the preventing, basically. So vaccine is for prevention.
Okay, yeah. And then you were already talking about this with Pfizer and Moderna, different companies that are offering the vaccines. Some of them have their own methods. Which one do you think is the most effective method, and why?
I think that's a very good question you asked, because, right now we have 2, which makes it simpler. Yeah. And the more we have, I think the more people will ask about which one they want to get. Right now, we have Pfizer, Moderna, and both are comparable. The efficacy and the safety for both the vaccines is quite comparable and similar. So both are effective, 95% or more, if anything. Then there are two more vaccines that are in the pipeline. One is the Oxford AstraZeneca, and overall efficacy that is reported for that is around 70%. And there's no data for efficacy yet that is reported for the Johnson & Johnson vaccine, but it's expected to come by the end of January.
Okay.
I would say, and those two vaccines might not be out. The emergency use authorization might be expected by April or so, the spring of 2021.
Yeah.
And like I said earlier, some protection is better than nothing. So, whatever is most easily available to you, you should get that, because you need to have protection rather than waiting another month, waiting for another different vaccine. It's better you get the shot that is most available to you.
Yeah, well said. So I think this is a current topic that's still rising. People are wondering who's the vaccine available to and why is that? So can you explain that?
So the biggest problem right now, Navan, is supply versus demand. Okay. So we have, say, in the US, it's 331 million population, right? So the vaccine doses that are distributed are only 31 million so far. And out of that, around 40% have been used. So there's more, around 11.1 million first shot doses have been given by December. And in Georgia, that's only 1.9%. So we have a huge percentage of population that still needs to be vaccinated. So the demand is way higher than the supply. So I think that's the biggest challenge right now. But that is also why they have to prioritize. Government has to prioritize, look at the sickest, who might bear the brunt of this infection. So that it's elderly population, 65 years of age or older, and then who are most susceptible to get this infection, healthcare workers or whoever are taking care, and they need to keep them healthy so they can take care of all the sick. So healthcare workers, meaning anyone from physicians, nurses to anyone working in a hospital, of course, or even in outpatient healthcare systems, and then all the first responders, firefighters, law enforcement, and long-term care facility staff, as well as residents together. So all these people are getting the phase 1A. That's what's going on right now. Let's see. I think the biggest challenge, once again, is supply versus demand. So the earlier the other vaccines are approved and out in the market and everywhere, the better it is for everyone to get earlier vaccination.
Yeah, the more options, the more people can take it. And then again, building upon that, what about people with special conditions or even allergies or disabilities? How are they supposed to approach this?
That is one of the most common questions I'm being asked by so many people. Like I'll just be walking in the hallway and somebody will ask me, can I get this vaccine? I just have cancer. I was on chemotherapy. Can I get this vaccine? Or I have this Crohn's disease and I'm on immunosuppressant. Is it okay for me to get the vaccine? Or I have very bad allergies to so many antibiotics and I'm afraid, can I get this vaccine? So very common question. I'm glad you asked me. So the most important thing to say is there is no condition, no medical condition that it is contraindicated to get the vaccine. Which is very good. And also, if a person has any allergy to any dietary food or allergy to any medicines or contrast dyes or anything, they are also okay to get the vaccine. However, they'll be monitored. Most of the people will be monitored for 15 minutes. But if, say, a person has severe allergic reaction in the form of anaphylaxis or immediate allergic reaction, which means within 4 hours of getting something, get a severe allergic reaction. So those people will be monitored for 30 minutes as opposed to 15 minutes. Okay. Now, the only people I want you to know, the only persons who absolutely should not get the COVID vaccine is that we are talking about the mRNA vaccine, which are in circulation, is people who have already had anaphylactic reactions to any of the components of these mRNA vaccines. Okay, so when you look at the components of the mRNA vaccine, obviously it has mRNA, but it also has lots of lipids and salts. And some of the and both the Moderna and Pfizer have something called polyethylene glycol. So something like that, if somebody had a very severe allergic reaction and anaphylaxis to that, they should not be getting these vaccines.
Okay. Yeah, I think that's something people need to know about because they have their fears on whether they can take it or not.
Yeah, but it is very rare, and that's not a common allergic reaction that we have heard of. So,
Okay.
I mean, but if that is something, then those are the people who should not get it.
Yeah. Okay. Well, I guess that's a good thing that it's not, that common. So I assume you already know this, but the flu vaccine, when the flu came out, it took about a decade for a viable vaccine to be there. And then polio, it took about 20 years for viable vaccine. With COVID, it's only taken about a year. But why is it that in general, it takes a long time to create a viable vaccine? And then also, what challenges does COVID-19 itself, specifically COVID-19, what does that present?
Yeah, so great questions, Navan. So first thing, we're talking about how it took forever for some of the vaccines to come because a lot of research went into that. And thanks to all that research and ongoing researches in vaccines, we come to this stage that, we just took such a short time. However, the reason why vaccines take a long time is because they go through some procedures. Like there's always studies done before introducing vaccines. So they do preclinical studies in animals to see safety and efficacy in animals first. Then they start the clinical studies in small groups, phase 1, small groups of individuals who are healthy adults. Then after going through that, then phase 2, they will pick similar age and health conditions for which the vaccine is intended. So those population, they'll do the studies.
Okay.
Then they will tally the results, and then they will move on to the phase 3 trials, which will include thousands of people. So usually each trial in phase 3 will consist of 30,000 or more people. So you need a big population to do that. So both Moderna and Pfizer, I believe, have done the phase 3 trial in over 70,000 people already. So we have data about safety and efficacy in more than 70,000 people. So that's a lot of information. And thankfully, all these volunteers who got these vaccines, again, around 24% or more were healthcare workers. So a lot of these people, it's because of them that we are now having the vaccine. It was earlier, but again, it was an emergency use authorization. Trials obviously were conducted faster, but nevertheless, we have very useful data from all that, more than 70,000 people. And as far as we know, it's very safe and efficacious.
Okay. And what, compared to other viruses, diseases, what does COVID itself, what challenges does that have in making a vaccine or even just treating it?
Yeah, I think, any RNA viruses, if you look into any viruses, I'm talking about RNA viruses, they mutate. We know that. It's very common for viruses to mutate, so much so that since the start, say December 2019, when it first was detected in Wuhan, China, since then, there have been so many different mutations happening. But what's important is, are they significant? Are they relevant such that the whole virus changes? Because why the virus mutates is it wants to survive and it wants to, adapt and survive.
Correct.
And if the mutation is severe enough, then it affects the whole virus and it leads to a different strain of the virus. So far they have found at least 7 major strains. And they have also found that the more the people are going from one place to the other, we're talking about continents, the strains, the mutations are happening more and more, and the strains are also increasing. Say, just to give you an example, when China and many of these Asian countries went into lockdown, the strain there stayed for a long time, which is the wild type L strain. Mm-hmm. But the UK and US, they did not fully lock down, and still the travel was still going on. So here, the strain that was already mutated kept on mutating, and it became so many variants kept on coming up. So that's what happens. The more people are traveling, the more chance for mutations. However, one good thing is the mutations have been going on very slowly, slow enough that researchers are able to figure what's going on and learn about these things. So while this is challenging, that this virus can continuously evolve and mutate, the vaccine, however, looks very efficacious even on these variant strains. And even testing also has not been a huge challenge so far, because you have to see the PCR testing, which is done, checks on multiple targets. So even if the mutation is happening on one target, the other PCR targets can still work. So even with regards to testing and vaccines, so far it's efficacious. But down the lane, whether the virus mutates much significantly into, targeting and making it difficult for vaccines to work and tests to work is to see. But once again, because it's been a slow mutating virus, the researchers are able to keep up with it so far.
Okay. Well, yeah, that's good news to hear. There's a bunch of mutants, but like you said, whether it actually matters or not is something, we need to look into.
But with regards to the challenges, that's the question you asked. So that's good. But with regards to challenge, I think the biggest challenge with the mutations happening or the variants that are happening is they're more contagious. So more and more people are getting sicker. I think that's the biggest challenge, because healthcare hospitals are not able to manage this surge. I think that is this challenge right now.
So it's just keep getting stronger and stronger. I guess it's hard to keep up with.
I wouldn't say it's stronger in terms of it's not deadlier for the people, but it's easily being transmitted. So the more easily it's transmitted, the more number of people are getting infected. And the more number of people, obviously, the more number, who will get sicker and getting admitted to hospitals. So the burden on hospitals is really increasing. And I think that is the challenging aspect right now.
Yeah. Kind of just to end this, I assume you, of course, are watching the news and seeing things. Cases are about 250,000 across the nation, sometimes on some days going to 300,000. And with so many hospitalizations and deaths, what are your predictions for the next couple months? And also just any last comments or advice on what we as a general public need to do to support each other and then mitigate this pandemic?
And one thing about this virus is it is being very hard to predict any sort of, about which way to go. Again, partly because not everything is on a strict lockdown, especially in the Western countries. People are still moving around. So obviously, the more variants there are, people are going to fall sicker. And we already know that the immunity is not long lasting from natural immunity. So people who have had COVID infection 3 to 5 months back, some of them are again. And rarely they are coming to the hospital also. So obviously I think the biggest challenge will be to control that. And right now it's hard to predict where it will go. If it is just one dominant strain, and everybody's falls sick, and then we have some sort of herd immunity, that's different, but that's not happening. A different strain comes, and then you can fall sick again with that strain. So right now they are predicting that the new strain that is detected in the UK first. Again, there are different strains all over. There is another strain that is now seen in South Africa, but the UK strain, they are noticing that it is it's contagious and it's going to more people. So they are predicting that will become the dominant strain by March. So with regards to flu, we always give predictions, but with regards to the virus, it's difficult to predict. I'm looking at very difficult winter. So the less we move around, obviously, the better it will be. Again, for the people to control will be the number one right now. When it is available, you get the vaccine. That is one of the best way to prevent you getting really sick.
Yeah.
Then even after you get the vaccine, it is very important you continue to use all the precautions, because not everyone around you must have received the vaccine, which means if they fall sick, until you build that immunity, you could get that COVID infection. So you have to continue using your mask. You have to keep your distance and wash your hands thoroughly. Soap and water. Again, if you protect yourself with the vaccine and all these precautions, you have a very good chance that you don't get it. Now, everyone in your house, if they follow all these precautions, it's an even higher chance that you're protected. And then if this extends to your community, the chance for protection is way higher. Yeah, and if it extends to your county and further on, it's higher and higher. So I think we should start right at home, because that's where you can do it better, and then educate people. And I think, as the vaccine is available, I encourage everyone to get it, depending upon if you're eligible at that time.
I agree. Taking all the precautions we can, try to be safe, even if it can be stressful, staying at home or not seeing people. But I think that's something we all need to know, that we need to try to be safe first. Thank you for your time, Dr. Doppalapudi, and thank you also for your efforts these last couple months. And I hope you have the great rest of your day.
Thank you for having me, Navan.
I urge all of y'all to educate your friends, family, and loved ones about the vaccine. If you know someone who is in need of it and is eligible for it, please urge them to take the vaccine. We've already lost so many lives, and we don't need to lose any more. If you need information on how to register for the vaccine, check out the description below. If we work together, things can become better. Thank you.